I want to give you some updates on a few things. I'll try to go through the packet too busy. The first one's our county health initiative. We have on the 31st, and next week we're going to have sort of a preliminary thing for the health summit where we're bringing together stakeholders in the county. I talked to somebody at Hearts, Ms. Ramey, and she was going to try to find somebody who could come to this thing on the 22nd, but I haven't heard from her. Is there somebody else I ought to talk to?
I'll talk with the nurse supervisor.
Okay, that'd be great.
I haven't been told.
Okay, that'd be wonderful, yeah. And so what we're going to do at that meeting is we're just going to do some brainstorming to get us to the October 26th meeting. That's going to be the actual health summit. We're going to hold it at the community center, and what we're thinking about doing, the idea is that organizations in the county would come and that they would commit to doing some kind of a health-related project. So different groups would do different kinds of things, and then we'd support them and come together at the end and just sort of evaluate how things happen.
You say it's going to be at the community center on the 22nd?
No, at the health department on the 22nd.
Okay.
And the summit itself will be at the community center. So that's where we are at that. I think we're moving forward on it. I think probably after the 22nd I'll have a better report to give you about what we're thinking. And we still have not set a date for the regular forum on the new federal health care law and what that means to people in West Virginia. We haven't set a date for that yet. We thought we got to make sure we got all these other things taken care of before we move on to something else. The next couple pages have to do with the stimulus, the ARRA project. The first one's the job report that we have to send in monthly. You'll see that as of the end of August, which was the 7th month, we had a total payroll in jobs in the county of just over $76,000, and the project has created 4 jobs and sustained 5. So good information to have. The next thing, which is the last meeting, I brought you the bylaws for setting up the maintenance organization. What we've been working on now is the actual agreement that the homeowner would sign with the organization. And this is the second draft that we've got. It sets out, who's eligible to be in the organization. We're talking about initially just having people who have gotten a new system through the EPA project or the DEP project, and to get it going with that, and then reach out to bring other people. And I know we've talked about bringing folks on who have systems that are working fine. We thought we wanted to make sure we got it started with the newest systems and then bring other people in. Currently, we're looking at an $8 a month cost. But that would be what it would cost you to join the organization. And then whenever you had any kind of work that would be done, it could be replacing a pump, it could be having your system pumped out, it could be having the required maintenance that happens. The homeowner would pay 30% of the cost, the organization would pay 70% of the cost. So it's sort of like a co-pay. And our thought is that because we're going to be able to significantly keep the cost down for people, we would get buy-in from the community on that.
You were thinking, I haven't read all of it, would there be some type of contract, pretty legal type document?
Yes, there would. In fact, this piece of paper, at the end of this, it states that, if people didn't pay, failure to pay would result in the homeowner being taken to court.
Well, how it is, there's always somebody out there that seems to test the rules.
Yes. We're hoping those people wouldn't sign up. The other thing that we build into this, let's say somebody had to have a new pump put in. The pump costs $300. The organization would pay the $300 up front, and the homeowner would pay their 30%. They would have up to 6 months to pay. So it's another sort of inducement for folks to join it because they wouldn't be smacked in the face with these huge bills. There are some things about, you know, you have to sign up. If you wait too long to sign up, then you have to pay for an inspection of your system to make sure it's working right. If the property gets sold, new people could join it within a certain amount of time without any kind of penalties. And then we listed on the bottom of page 2 the kind of responsibilities the homeowners have, because we think it's really important for people to understand that you got to take care of these systems. And then at the end, we have some kind of a, this would actually become a signed agreement between the homeowner and the association itself. So this is still a draft. My thought is that the committee that's been working on this will probably spend a little more time on it. Then we take it to the community. They would approve it. We are about ready to send in the incorporation papers, and then the next thing we do, we go after a 501c3. And once all those things were in line, then we roll this thing out and actually start.
How are we going to involve the health department as far as inspection, determining what level of efficiency this, thing is working in, so that there is a, when there's a problem, when there isn't?
There would be a contract with a maintenance provider, because with the direct discharge systems, you've got, the DEP requires that you, the homeowner, have a contract with the maintenance provider. So the association would bid out to whomever a contract that would take care of everything. So we have one maintenance provider who would be providing for all the systems. And there would be, on certain different kinds of systems, have different requirements for how often they have to be checked, but every system would be checked at least once a year.
Is that like, one I can think of is like Fred Snodgrass does?
He does those kind of things. He does them with aerators. We need to find somebody who'd want to do it, first of all, and then we need to find somebody who's got the skills in all these different kinds of systems.
Yeah, I'd say he's got more work than he can
I think he probably does. And it may end up, I mean, we've talked to some providers that this might actually generate a job for somebody in the community. Because in some ways it would make more sense to have a local person be the maintenance provider, so that you wouldn't have to send somebody all the way from.
Yeah, if you get somebody over in the watershed.
So we're working on that. I'm not sure exactly how, I don't have a timeline on it. We're moving forward. The next two things have to do with this new project that we've been talking to the DEP about going after some more money. We're looking at 20 more systems. On Monday, we're going to have a community meeting, our normal community meeting has been in the evening. We're going to have that in the evening, but we're also going to have a 10 in the morning meeting, because there's some people who work and can't come to the evening meeting. So one of the things we'll do at that meeting is give people a chance to sign up for consideration for this next round. I'm not sure how many people are going to show up. I'm guessing that we probably won't have more than 20, but it's hard to tell. We sent letters out, we put things in post offices and stores, letting people know it. But they would fill out this one pager and some things that we've added to it because of what we've learned. We've said that if they decide they want this, they've got to join the maintenance organization for at least 3 years after they get 2 years free from the contractor, then they have 3 more.